Actually, it started almost 11 years ago. And the idea, I thought, was a brilliant idea, just to keep the hematologist aware about some rare disease in hematologists. In that specific case, we are talking of lysosomal disorders such as Gaucher disease. The idea of Sherlock Holmes was to keep the participants, to keep the attendees to the symposia very much involved in the scene of the patients and going through clues and questions, trying to find the real diagnosis at the end. So Sherlock Holmes was involved as let's say, someone who has to find the clue to reach or to solve the crime. We found that after the first symposium, the participants enjoyed very much, and they were asking for having similar repeated symposia, and we reached the 11th this year, where we presented 6 different cases, real cases, with different diagnoses. So you may have the suspect of the disease, but that's not probably what you are suspecting at the end. So it's quite intriguing, but at the end of this 10 years history, we realized that the symposia contributed significantly in increasing the awareness of hematologists for this kind of rare diseases, but I personally feel that are rare because we are not looking at them, and as soon as we know better the disease, they probably will be more common in hematology setting. Well, the main purpose of this symposia is to increase the awareness of hematologists, either pediatric and adult hematologists, in the area of rare hematological disorders. And especially for this kind of Sherlock Holmes symposium, we are focusing on lysosomal disorders, especially Gaucher disease. But during the symposium, we are presenting 6 different cases. Not all are Gaucher, but some are similar, or they present same signs and symptoms. So the challenge is the differential diagnosis. And the main purpose is to make hematologists aware that Gaucher disease is a rare disease in the hematology setting, but is presenting with some sign and symptom which could be underestimated. And splenomegaly, thrombocytopenia, when a hematologist has excluded a malignant disease, they say, okay, there is no reason to go further for diagnosis. Whereas it is extremely important to diagnose Gaucher patients at an early stage. So the main purpose is to increase the awareness and to keep in mind that Gaucher has to be in the scenario of differential diagnosis of a patient with splenomegaly and thrombocytopenia. Well, especially for some rare hematological diseases, nowadays we have some treatment. So most of these disorders are hereditary or are genetically based. So as early as the diagnosis is made, as early you can start the treatment. And because usually are chronic progressive diseases, I mean, as early as the diagnosis is made and the treatment is started, you can prevent complication. Sometimes the diagnosis is made on the 3rd, 4th decade when some complications are already there. Some could be irreversible. Whereas if you start at the proper time the treatment, so the main challenge is an early diagnosis, because today we have the treatment, and that is the main reason.